Hello, this is Dr. Batal, and today I'm talking about the algorithm of analyzing the fullness in the chest in men, which is called gynecomastia. Gynecomastia means an enlarged gland. It is an actual breast tissue in men that get enlarged in various stages in life, like at birth from the hormones that comes from the mother, or during puberty due to the imbalances in the estrogen and androgen level, and later stage in life during the decline in the androgen and the weight changes that happen. It persists in some people, and regardless of the lifestyle and the weight, it could still get enlarged. It is responsible for that fullness. The term pseudocomastia is where it describes the fullness where the fat is the main component. And the only way we know the differences is by doing an actual exam. And often the case you have both components happen, the gland and the fat. If the gland is the main or the only component, the treatment is simply surgical. We do a small incision around the nipple and we dissect the gland off in a vascular plane. The gap that happened from the gland should be bridged by the tissue around to minimize any dipping of the nipple. If the fat is also involved, then I recommend also doing liposuction along with the gland removal. And this could maximize the definition in the chest depending on the need. Trickiest component of all is actually the skin. Skin could stretch out as a result of the fullness in the chest, and in majority of the cases you'll be able to retract it by either non-invasive technique like a helium plasma skin tightening. However, in some cases the skin is actually had an excess that requires some form of resection. Sometimes we do a donut technique where we remove extra rim of skin around the nipple. But in some cases, and especially after like a weight loss cases, you see the chest kind of dangles down and the skin is having major excess. Then you need to form like a incision in the inframammary fold. In about 80% of the cases, the surgeons remove all the tissue and then they leave the nipple in like a sticker and they do a skin graft for the nipple. A technique that I personally do not prefer. I tend to leave the nipple in a flap of skin and deliver it in a natural way in the normal position. However, this is reserved for only like 10 to 20% of the cases. But I'll be happy to evaluate any case that you have concern. You can send us pictures and we will tell you what we think the best treatment is.